antiviral stimuli secondary to infection process. The nurse team should prioritize antibiotic treatments, testing the urine-specific gravity to assess the fluid status. If severe, they will be treated with antiviral agents such as acyclovir. Nursing team will make sure bacterial meningitis treat immediately with intravenous antibiotic and some corticosteroids to help ensure recovery and reduce the risk of complications such as seizure and brain swelling. Educate the patient and their family about medication and the importance of taking antibiotics. Explain to them medication must be taken on time. The side effect, educate them about antibiotic and combination of antibiotic, depending on the type of what bacteria causing the patient infection. Some patients require to be hospitalized for fluid administration and pain relief, while others can be safely treated at home. To conclude, panic sign is also correlated with other disease. If positive after the test is performed, the presence of meningitis is also present. The Kearns and Barberski sign are used at bedside to help in the diagnosis of case suspected meningitis. Those two tests have a limit part in ruling out meningitis in their absence. With small sensitive of 5%, after several researches, I find out that meningitis is among the top 10 infections in the world, causes of death, with a mortality rate of 20% to 30%, that is responsible for approximately 1, 135,000 deaths each year. And I give my references.
Any questions? Ms. Cox, well, what is the second, sign she said it's used to rule out or ascertain meningitis?
I know one of the signs is
No, that she just spoke about. She gave you the one that she was talking about, and then she said your second just before she finished. Back to that. What was she talking about?
penny wheel.
Mind telling Miss Antoinette what you were talking about?
Panic sign.
You say
Panic
penny.
sign.
So like start with a K. So like penny on the
Next, you want to tell Miss Cox. What was the next?
Tell me the name of it.
Panic. Kerng.
What was the next sign?
Bobrovsky.
Government.
Bobrovsky.
Penny football.
Panic sign.
Kernig.
And that's Washington.
No, this is not. So I'm going to talk about the effects of propinerol on a patient with Parkinson's disease. Parkinson's disease is a chronic, progressive neurodegenerative disorder characterized by slowness in the initiation and execution of movement, increased muscle tone, tremor at rest, and gait disturbance. While there are many drugs that are used to treat the symptoms of Parkinson's disease, we will look at ropinerol and its role in the treatment of symptoms of the disease, side effects, and possible complications. Ropinerol is used alone or with other medications to treat the symptoms of Parkinson's disease your ability to move and decrease shakiness, which is tremor, stiffness, slowed movement, and unsteadiness. This medication works by helping to restore the balance of a certain natural substance, dopamine, in the brain. Medication is taken by mouth, with or without food, as directed by the doctor. The side effects of ropinirole include nausea, drowsiness, confusion, swelling of legs, hallucination, unusual tiredness, and weakness. To reduce the risk of side effects of the medication, the doctor might start the patient at a low dose and gradually increase the dose. Patients should not stop taking medication without consulting the doctor, as your condition may worsen if you stop taking it suddenly. The nurse would use nursing intervention process ADPI to assess, focus, and implement care that enhances patients' quality of life. The nurse would assess the patient's activities of daily living, ADL, look for disabilities and functional changes that occur throughout the day, how patients respond to medication, observe for complication and side effects. Because Parkinson's disease is a chronic degenerative disorder, the nurse would promote physical daily exercise that will increase muscle strength, improve coordination, reduce muscular rigidity, and prevent contracture. Educate patient to concentrate on walking erect to offset the shuffling gait and tendency to lean forward. Monitor patient's weight to see if caloric intake is adequate, as patient may have difficulty maintaining weight because chewing and swallowing might be difficult due to the inability to move facial muscle. Nurse would have patients sit in upright position during mealtime, provide semi-solid diet with thick liquid, as it's easier to swallow than solid.
The drama medication she was talking about.
I don't know. I can pronounce it very well. It's Warren something. What is it? Rock and roll.
What was it really this medication was for? What she says medication is about?
Are you talking?
Say again.
Are you hear that?
You didn't hear what I was saying?
I hear what you said. What
You
the
didn't hear what
medication?
she was saying. So you just sit and say speak. I don't know what you're saying. If you can speak up. Professor?
Utah. That was the first word on the course. Utah phenomenon. Utah is a sign of ephemeral worsening of neurological function less than 24 hours. This occurs in multiple sclerosis patients when there is an increase in the patient body called temperature. This may occur due to hot weather, exercise, fever, hot, hot tubs, hot bath, and hot food and drinks. With an increase of body temperature, nerve impulses are blocked or slow in the damage of nerves. Once body temperature is normal, signs and symptoms are usually reversed. The condition is named by Wilhelm Rudolph, a German neuro-ophthalmologist, who first describes it in 1890. He noticed many of his patients reported that their vision problems worsened after exercising. Christoph linked the worsening symptom to the exertion of exercise. However, today we now know that the effect is caused by increase in body temperature. Multiple sclerosis is a disease in which the immune system eats away at the protective covering of nerves. In MS, the immune system attacks the protective sheets or the myelin that covers nerve fibers and causes communication problem between your brain and the rest of your body. The exact cause of MS is unknown, but we do know that there is something that actively trigger the immune system to attack the brain and the spinal cord. There are four types of MS: clinically isolated syndrome, relapsing, remitting MS, primary progressive MS, and secondary progressive MS. Clinically isolated syndrome is a single episode of neurological caused by inflammation of demyelination in the central nervous system. The episode, by which definition, must last for 24 hours. That's the clinically isolated syndrome, um, lasted 24 hours. It is characterized by multiple sclerosis but does not yet meet the criteria for the diagnosis of MS because people who experience CIS may or may not go on to develop MS. Relapsing remitting MS is the most common type of multiple sclerosis. Approximately 85% of people with MS this type of have this type at this time of diagnosis. RRMS is characterized by clearly defined attack on new increasing neurological symptoms. These attacks, also called relapse, are followed by a period of partial or complete recovery. During this remission, all symptoms may disappear, or some symptoms may continue and become permanent. RRMS is also further characterized as either active or not active. Active meaning with relapse, and not active meaning of no relapse or evidence of MRI activity or over a specific period of time. Secondary progressive may involve a period of relapsing remitting activity with symptom flares up, followed by recovery period. However, the disability of MS does not disappear between recovery period. Instead, people with progressive MS have a period of fluctuating symptoms followed by a worsening of condition and may experience minor remission or plateaus of their symptoms. Moreover, without proper treatment, patients who have RRMS still go on a develop progressive MS, progresses slowly yet steady from the time of onset. PPMS is characterized by worsening neurologic function from the onset of symptoms without early relapse or remission. Progressive MS can further be characterized as their active, meaning there are occasional relapse, or not active, meaning there are no relapse of MIR activity. Multiple sclerosis cause may different symptoms, including vision loss, pain, fatigue, and impaired coordination. The symptoms are severity as well as duration vary amongst patient to patient. Some people go symptom free for majority of their life, while others can have severe chronic symptom that never goes away. The first sign of MS include vision problem, tingling and numbness, pain, fatigue, trouble balancing, bladder issues, sexual dysfunction, and connective problem. Multiple sclerosis can occur at any age, but onset usually occur around 20 to 40 years of age. Real symptom of MS can be issue with speech, swallowing, breathing, and the MS hug that patient described as feeling a pressure around the chest, like being squeezed. There is no cure for MS currently, but it is possible to treat the symptom with medicine and treatment and other treatments. Treatment of relapse usually involve a 5 days course by steroids, tablets taken at home, or injection of steroid medicine given in the hospital for 3 to 5 days. Treatment for specific multiple sclerosis, such as muscle spasm, can be improved with physiotherapy. If the muscle spasms are severe, you may be prescribed a medicine that can relax your muscles, such as baclofen or gabapentin. For neuropathic pain, can be treated with gabapentin and the same as gabapentine, or which medicine called um, amitriptyline, MS-related vision. Problem will often improve it on their own, and fatigue can be managed with exercise, keeping healthy sleep patterns, and energy saving techniques. Um, my nursing recommendation for patients with severe multiple sclerosis symptoms such as muscle spasm and neurogenic pain is to ask your physician or prescribe anticonvulsant such as gabapentine and gabapentin, and physiotherapy will be also lessons fatigue, and the most symptom of MS would recommend the patient have consist rest period of time, such as afternoon nap. This will reduce fatigue and aggravation of muscles weakness to worsen in the late afternoon. When body temperature rises, a patient should invest in a cooling vest. It will lessen fatigue while also stabilizing the body temperature to reduce frequency of relapse.
Good evening, class. My topic was on limerick sign, also known as barber share sign. What is limerick sign and what are the nursing considerations? All right. What is limerick sign and what are the nursing considerations? Limerick, Limite, apostrophe S, sign. Limerick sign. What is limerick sign and what are the nursing considerations? The sign of symptoms can last just a few seconds, starting, no, startling and intense. It is a burst of pain like an electrical shock that reverberates down the client's back. into their arms and legs. But this sign only occurs when a client moves their neck. This phenomenon is often one of the symptoms that people mention when they are first diagnosed with multiple sclerosis. Although the pain can be a very painful problem, it is not considered to be life threatening. Studies have shown that with time or treatment, some people will gain permanent relief from having this limit sign. Some clients report pain, especially in the lower thoracic and abdominal regions. Often, common problems include speech impairment, hearing loss, tremors, and dizziness. Possible cerebellar signs include nystagmus, ataxia, dysarthria, and dysphagia. Many patients have severe, even disabling fatigue. This is worsened by heat, humidity, and medication side effects. The sign is usually elicited by the examiner when the patient is supine. Now let's dive deeper. Let's dive deeper into the action of this sign. Um, for example, when a client has multiple sclerosis, the immune system begins to attack the fatty coatings known as the myelin sheaths. The purpose of this coating or sheets are meant to protect our nerves, and without it, the formation of scar tissues occurs, and thus scar tissues eventually start to block the normal messages that is supposed to travel to our brain and our spinal cord. This lemon sign is but one of the early symptoms that occurs whenever those signals do not move. Those signals don't move like they should as a result of multiple sclerosis. Although multiple sclerosis is not the only condition that has this potential of causing lemon sign, this sign can also happen to people with various other disorders that affects that are affecting particularly the upper portion of our spinal cord. This sign can also occur with people who are suffering from severe lack of vitamin B12, B12, B6, B6. I'm sorry, typo. So it goes without saying, the medical professional, primary care physician, will have to test for all these potential factors that may be causing the client to exhibit this sign. Now let's talk about what are the treatment options and or therapy. A client with multiple sclerosis can trigger this sign whenever they're exposed to overheat. So the nurse will educate the clients to avoid areas of high temperature. Also, signs Also, the sign is caused by certain turning of the neck. The nurse should also educate the client to avoid bending his chin to his chest. Other interventions that will affect this same result is a that will affect this same result is a neck brace that may be used to prevent flexion of the chin to the chest area. Other possible options that may be offered by the doctor are an electrical stimulating devices. This device acts by sending low voltage electrical signals to the nerves to promote the proper flow of nerve signals that are otherwise blocked by those scar tissues caused by multiple sclerosis. This low voltage of electrical currency acts on this blockage by breaking them down to allow the passage of the signals that are otherwise blocked. There are also various messages, sorry, other various massage techniques that could help to relax the muscle and relaxation, the nerves in turn, since the muscle and nerves work hand in hand. Another is deep breathing techniques are also helpful for relaxation. Stretching is also helpful to make the muscles and in turn the muscles more flexible. Here are some pharmaceutical options: anti-seizure drugs, muscle relaxers, antidepressants, sodium channel blockers, and steroids. And that is all I wrote.
What you like for coffee?
I'm still good.
That'll be your B6 and your B12.
Yes, and other stuff.
Um, the Womber test is a test that measures the sense of balance. The Womber test Wombers are all yeah. The Womber test is useful to diagnose tool for diagnosing sensory ataxia, a gait disorder caused by abnormal pro-
Flow, flow,
proprioception, thank you,
proprioception.
including proprioception,
Proprioception.
including information about the joint location. It has also proven to be a sensitive and accurate means of measuring the imbalance caused by central dizziness, peripheral dizziness, and head trauma. It has been used in clinics for 150 years. Enforcement officers can also use the modified rumbar test to check a person drinking. For example, it can be used to determine if a person is under the influence of alcohol. A sign of rumbar is present when a patient is able to stand with feet together and eyes open, but sways or falls with eyes closed. There is no current medical prescription for Womber's. Womber's test is performed to assess the sense of balance and proprioception in a person. The most important nursing intervention for a patient about to undergo this test is to ensure the patient's safety and not whisper softly into each of the ears of the patient. The nursing conclusion is testing the patient for balance by asking the client to stand erect with feet together and arms at the side. First with eyes open, with the with both eyes closed for 1 full minute. The client with balance problems become more unsteady with his or her eyes closed. Watch the movement of the client's body. The slight sways is normal. A positive rumbar test is noted when irregular sways and toppling, falling over occurs when the eyes are closed.
All right, what we heard was persons who did their assignment and brought in their assignment. Last week, we went through signs of certain disease processes is related to the central nervous system. Persons were asked to do a quick review and then to present it after they were told to bring in today, a week later, a complete research on it to get a better understanding of what it's about so you can identify what are the signs. Because as a nurse, you're required to do tests. And all these signs are tests that's related to the CNS, at least the ones that you just talked about. So at this time, I've got five. I have five. We have a class of 12, five return. I don't know why persons didn't do it. And I must also say, if you are absent on a specific day, it is your responsibility to find out what was done and what you need to do. I'll take questions at the end of mine.
I wasn't here, but I have all the thing that you gave. But I asked her. She told me that you gave each of of the
Each
students.
person was do something.
Yeah, but
And
I wasn't here, so I didn't do anything.
that's what I
So,
said. Wait until I finish the presentation.
huh?
I said to wait until I finish what I'm saying so you can fully understand where I'm going.
Okay.
All right. Now, every person who were here last week was given one of these signs and or a drug that is used in the system. So we were going to complete the CNS, make sure that you fully understood the CNS. I'm kind of disappointed today to find that there are several persons who were here, did not bring anything in. And that is troubling to me, very concerning. I'm hoping that this behavior will change in January. Because one of the things I don't like to do is ignore people. When you're teaching, you teach people who want to learn. People choose that they can do what they feel that they don't have to follow a program because they're paying some money. This is a program, and I expect persons to follow my program. You pay Stanley his money, your money, or whatever, but I'm the instructor, and I'm running a program. And I'm telling you guys, it was without nothing in my mouth, that the expectations is that you will comply with whatever is required in a program. If you were in school, if you were in a nursing school, you'd have been kicked out. So I'm getting this feeling that persons feel that they don't have to do anything because they're paying some money. And then there will be failure at the end of it, and then what you're going to do? Blame the tool or blame yourself? I'm taking baby steps with you guys. Why I have to take baby steps? Because many of you have never, most of you in this class, have not done the required prerequisites. So I'm taking very baby steps. Again, so this is very, I want to say very, but this is disappointing. I don't know what persons have in their head or where they're going. Please, in January, let's see a change and a difference. You came to the classroom today, you see how the classroom is set up? You see those things that's placed in the wall? Everything in this classroom, I did by myself. And I'm not finished. Am I getting paid for it? No. Because I cannot come into a classroom that looks so damn confusing and asking students to find stuff and they can't find it. Read a floor that is damn nasty and that sort of stuff. I can't. So I took it for myself to do everything that's in this room. I didn't ask for help from nobody. I didn't ask the student or ask the VIPs upstairs that they can come and ensure they take some of these things out of here, which is like that thing that was there. But everything you see here, what's on the wall, all these things that I put up, I did it on my time. I'm not asking anybody for money. I didn't ask anybody for a cent because I've been asking for stuff and I never got it. I do what I have to do. You need to do what you need to do if you want to learn. And I'm very disappointed. Very disappointed. And hopefully in January you guys can understand what is to be a real nurse. Not pay somebody to say I'm a registered nurse. But being able to function and be able to distribute and ensure that persons will be able to respect you as that wonderful person that you're supposed to be. This afternoon we're going to go over into GI system.
GI.
System, so the next. By the way, I'm sure I put these up here. Why one of these things is here, and I'm sure I put them in the places and what to take them off, is because right now, most of you have been doing anatomy and physiology, but you've not gone in depth. And you're finding that medications and disease processes affect certain things. And unless you understand, like when we talk about the dopamine in Parkinson's disease, we understand where the dopamine is produced. How does the medication affect that particular area? What is the basal ganglia? That sort of stuff. So now when you come in and you have done something, look at these here because this is what you really need to know. Guys, save me. As a registered nurse, what's up there, all those little fine prints and where it is, that's what you need to know. And if you've done your prerequisites, this is what you have done. Totally in there. But now you have it up there. You have an idea because you've been exposed. So you're not going to have what? That stress of trying to understand big words and that sort of stuff. So utilize the time, please. Please utilize the time. All right? Okay. So for the next next 30 minutes, please go over everything that you need to know about the basic anatomy and physiology of the GI system. Because when we start, it's not going to be no slowing down. Actually, I just saw this on there, and this is over about nearly a year old. It's one of the students, and she wanted to talk about Crohn's disease, so she put together something. Maybe you guys can look at something like this. You have the time, and see what, although roughly whatever it comes to be. Found that Crohn's disease, which is one of the things that come in the GI system. I invested this up on there. It's very easy. But that's a dedication. When you have dedication to something, you will do it, right?
Amen. Amen. I accept it. I receive it. You talking about hydrochloric acid over there? Which hydrochloric acid you mentioned over there? You got a different hydrochloric acid?
That is the
Mm-hmm. Mm-hmm. What does it do? What does it do? Mercedes. Who produced the hydrochloric acid? Mm-hmm. Mm-hmm. Yeah. Mm-hmm. The pyloric sphincter. Mm-hmm. That's a GI, right? What does the sphincter do? What does the sphincter do? What role does it play? Mm-hmm. Interesting.
Remember when you're studying your EMP right now, you're looking at it because you're going into the pathophysiology of it. So if you don't know the basic, you will have some difficulties. So please focus on what you're looking at. Please try to understand because you might have done, in fact, you've done the GI system before, but now you're doing the GI system that is affected by diseases, not the normal. So you have to know the normal to understand what is the abnormal, make that comparison.
Hmm. Mercedes, Mercedes. There's the upper esophageal sphincter. There's the lower esophageal sphincter. The upper, the upper esophagus, the upper one. What's the purpose of the upper one? No. The upper esophageal sphincter, right? Then there's the lower esophageal sphincter. The upper esophageal sphincter is to prevent air, and the lower esophageal sphincter is to prevent the reflux. Uh-huh. Mm. Is to prevent air from entering. The lower is to prevent acid and the food from. Mm-hmm. Mm-hmm. So I told you mine. You gotta tell me yours now, okay? I don't understand. I still don't understand yours. Tell me yours. What do you mean? I want to learn. This is class. We have to learn. And the cardiac. Mm-hmm. It does what? Mm-hmm. And their function is to just. Mm-hmm. Huh? Okay. The pyloric. Uh-huh. Okay. Let me keep reading. Okay. Okay. Thank you. Hmm? Mm-hmm. Oh, that one. Okay, it says here the esophagus extends from the oral pharynx to the stomach, right? At the top of the esophagus is the upper esophageal sphincter to prevent the influx of air into the esophagus during respiration. At the bottom of the esophagus is the lower esophageal sphincter to prevent the reflux of acid from the stomach into the esophagus. That's all they said. Mm-hmm. Mm-hmm. Mm. Well, that thing is a muscle, right? Right? And and if it's weak, food will go up. But it's not weak; it's working good. Mm. Mm-hmm. We're talking about the trachea. You talking about the trachea, you talking about the glot, what you call it, Yeah, the esophagus. Esophagus, right? Mhm. Okay. Mm. Mm? Oh, don't say nothing. Don't give me the answer.
Oh,
It's
please.
called peristalsis. Yeah, yeah, yeah. Peristalsis. Don't give me the answer. You're not gonna be there when I take my boards. Please, I beg. Don't give me the answer. Please, I beg. Please. Okay. Let me struggle now. What's the three parts of the small intestine? What's the three part of the small intestine? The three parts of the small intestine. The duodenum, the ileum. Tell her, tell her. Tell her, tell her. The duodenum, the jejunum, and then the ileum.
What is the
I think the ileum is the last one.
Which one is the first one?
The duodenum. Mm. The duodenum. Duodenum. Uh-huh. Then the jejunum. Then the
The
ileum.
ileum is the one at the bottom.
Mhm. Mhm. Let's go back. Let's go back. The cardiac sphincter also. What does it do? Ah, that was the question I was asking you before now. Yeah? I was still waiting for the answer. Hmm? Backflow of what? Air or what? Backflow of what? Food? The food? Okay, okay, okay. And then the other one. Mhm. Right. And what's the other one you looked at? And what was the second one you was looking at just now? pyloric sphincter.
This pilot
That was pyloric, right? Pyloric sphincter.
the esophagus two sphincters, one in the top and one in the bottom.
Mm-hmm.
That's what he said.
No, I mentioned that one already. That's another sphincter. There's many sphincters in the body. Many sphincters. You have the cardiac sphincter. You have the pyloric sphincter. You have the esophageal sphincter. Two esophageal sphincter. The upper and the lower.
The pyloric one is
Huh?
the one to the pyloric one.
Mm-hmm.
They said is the one to
Prevent.
no, is the one to open and
Mhm.
close. When the acid is too much, it's closed automatically.
Okay. That's what she said. Yeah, that's right. I remember.
All right. I don't want to focus on the disease processes. I just want to focus on what's normal.
Yeah.
All right.
Yeah. Hmm? Mm-hmm.
I want to hear you talk about it for, like, what is an enzyme? What's a pH? Where the pH are at? Which part of the body, which part of the system? Those are things you need to look at. All right. And you need to understand that you must also know what is your my macronutrition and micronutrition. I want to trace minerals because that's also plays into digestion. You also need to look at your biliary system, the common bile duct, the pancreas, because all that is associated with digestion, the liver. guys, you guys know Peter, right? Right? Now he's cooperating, getting this place together, right? So we're getting the board, which he'll be doing, right? He'll also be putting in the floor tiles to you guys, right? So when you come in January, you're gonna have a brand new place. And all the little stuff I'm working on so that you should have no concerns.
That looks good in here. Looking better, right?
Much better.
Polish this floor. I'm gonna fix the shades. I already know the shades. This
So things will be done and you will have no situation where your education is being impacted by the environment that you're studying. Okay? Thank you so much.
Give Peter a hand of round of applause, everyone. Give Peter a round of applause.
It's him. He's a great teacher, man. This dude,
Yes.
good man. Not just
Yes.
a good teacher, good person. Good human
Yes.
being.
All right.
That's the truth.
Yes.
Yes.
Maybe with Peter.
Appreciate you, Mr. West.
That's okay. As far as I'm concerned, once I'm an instructor, it's getting through to the students in whatever way you get it.
Spanish.
You got some more? Got some more news?
Hmm? Nobody's for Christmas. Mhm. Hell yeah. Yeah. Day one. What is this? Day four. Exactly. Mhm. Yeah. Can't even. I should have an offset for my computer and 2 books. Yeah. Exactly. Got some nerves. They didn't say nothing about the chairs. Got some nerves. Yeah. Hey, baby steps. You're right. The next class. The next class will get chairs. I'm grateful though, man. It's something. It's something.
Everything is 2 hours. Why? The one income? No, the one you see that like to show up on my she's the oldest.
IKEA.
Oh, please,
Uh-uh.
leave me alone.
This
I'm
is
not-
this
I-
is
I was at your
this is
parents.
the last day of
Do I
class. You
give
cannot
you
tell
your
you
na-
can
your
still
name?
cannot pronounce my name.
Tomorrow.
There's no class tomorrow.
This class tomorrow. There's no class tomorrow.
Where do you get that?
He said Monday.
No,
No.
that's not true.
Tuesday.
Okay,
You
somebody
make it
somebody
up.
send me the notes for tomorrow, please.
You make it up.
You have no plan to come tomorrow.
That's the way you
Go
are.
ahead. What did you say?
Anytime you want to do something,
You're
you
talking
put it
about
your
something
way.
else. Go back to what you're talking about, please. I don't want to argue with you, my wife. Go ahead. What's going on?
I'm gonna rewrite this and send it to you. Type it from here. Send it by email.
You want me to type this for you? While I'm supposed to be studying for the test, you want me to type this for you? Huh? Okay, send it to me. I'll type it. No problem. No
I
problem.
can't deal with you, sometimes. Okay, I'm talk too loud.
But I need what do I need from you?
What did I tell you? Before
I'm coming.
you finish this,
I'm coming. Wait, hold on. Tomorrow? Yeah, I'm coming tomorrow. Yeah, I'm coming. I'm definitely coming. Yeah, 2 weeks. Yeah, I'm coming. I'm definitely coming. I need
We should have a party tomorrow.
we should have a party tomorrow.
We
We should. Yeah. No scrubs.
No, he wants us to. Bring protein. He wants us to.
He wants us to do this kind of, yeah. He wants us to do this.
We should do something.
Yeah.
What is that?
I'm gonna bring a cake,
Okay, so everybody.
a cake for him.
So let's bring some.
I'll bring a cake. Yeah, yeah.
So let's bring something to everybody.
I got the cake. I got the cake. I'm gonna write this down. I got the cake.
I can do without the cake.
We need cake.
With me?
I'm coming from work. I'm not coming from bring the drink.
Yeah,
Plate
right.
and forks.
Yeah, buy some. Get 20.
Listen, hello, darling.
Get 20 wings. Get 20 chicken
She's
wings
gonna bring some black
from a
rice.
Chinese food restaurant.
No, she's home. She's home. She's home. She
What
can.
you gonna bring? What you gonna bring?
I'll bring barbecue.
You bring barbecue chicken?
Yes, next to make the gravy.
Huh?
Are we eating?
No, he said we can eat together. You
Yeah.
can just on your
Yeah.
He did say
Do
that.
whatever you want.
We'll
Yeah,
eat
you said we're the
together.
only class that don't do anything. So
That
let's
don't do anything. He said
Mhm.
we eat as a class, not eating in his class.
What
Remember
you
he
going
said
to
that?
do?
Yeah.
What you going to do?
I'm gonna make barbecue chicken in a small tray of
All right, so let me start writing it down. Okay, IKEA. I'm writing it down. IKEA. I'm getting the cake.
I'm coming from
All right.
work
Okay.
too.
Mhm.
I'm thinking of some
Simone got the cake. Simone got the cake. Okay. IKEA. I'll bring I'll bring like a 6-pack. I'll bring like a
You bring
6-pack.
the drinks.
All right, I'll bring like a 6-pack of
I'm gonna come with some kind of orders.
All right, we have to take a vote between. Yeah,
Hello, darling.
we have to make a vote. Let's take a quick vote. Between Heineken and Corona. Heineken or Corona.
So we get rolls then. We can get some rolls.
What about barbecue chicken?
Yeah. We can. Hold on now. Let's organize. People. Everyone. Let's organize. So let's take a quick vote, okay? Okay. Raise your hand if you want Heineken.
We cut the rice, right?
No
Okay.
alcohol.
Raise your hand if you want Corona.
No alcohol.
No rice. Remember, put my name out for the rice. I'll bring
I'm bringing a
something
6-pack.
We doing the drink.
Guys, relax. Hold on. We're still in class.
Let's be serious now. So okay, we're gonna do like
Fruit salad.
Dinner roll.
Pizza.
Yeah, we have. You have this Chinese place.
But we have microwave there. Half of it and to make it nice.
Snyder.
You know about it?
Snyder chicken, but I'm coming from work. I won't have time.
Antoinette, can I
So
get
give her the money. Give her the money. She'll bring it.
Yeah, some chicken wing. Some
I'm doing barbecue
no, but
chicken.
it's two different
Oh,
kinds.
chicken.
Okay, hold on. Everyone, hold on. Okay, Barbara is bringing you said barbecue chicken? Barbecue chicken. I'm writing this down. Barbecue chicken.
Fried chicken.
All right.
Dinner roll.
And then Mercedes is bringing
Dinner roll.
fried chicken.
Fried chicken.
Fried chicken. Okay.
Simone,
Okay, who else? That's 3 people so far. 3 people, okay? Simone, cake, Barbara, barbecue chicken, Mercedes, fried chicken. Who's next? Come on, let's make this list.
Somebody not bringing fruit salad. There's something like that.
So sparkling salad.
She cannot bring the fruit salad. I don't know what to
jerk
bring.
chicken to
Yeah.
Huh? Fruit salad. All right. How do you spell your name again?
MERLA.
You're bringing fruit salad. Fruit salad. All right. I'm bringing All right. Since nobody wants no alcohol, I'm gonna bring what I'm gonna bring. I bring sparkling cider.
No, we don't want to. I bring Shandy then. If you insist, bring Shandy.
No
All right.
alcohol.
No
Shandy.
alcohol.
We bring Shandy.
What are you talking about,
Shandy don't have alcohol.
Mr. West? Okay, I bring Shandy and Belize.
She said no alcohol. She said no alcohol.
Wait, Baileys is good. Baileys is good. Baileys is good. Baileys is good. I bring Baileys. I bring Baileys and Shandy.
Who we're gonna put it on? We need a table, don't we?
Baileys and Shandy.
Don't we need a table?
We don't have proper chairs. Where we gonna get? No, we're gonna ask the guy.
Okay. Let's go through the list again. Simone cake, Barbara barbecue chicken, Mercedes fried chicken, Marlon fruit salad.
No, change that. Antoinette is bringing fried chicken.
1 second.
Okay,
I'm
Antoinette.
gonna do some jerk chicken.
Which are we gonna eat it? 1 second.
Yeah, we're gonna have chicken all over.
Mercedes.
We're gonna be
That's why I
fine.
think like a different kind of chicken. What we use
I bring the chicken, fried chicken.
All right. So okay.
We're gonna be fine.
So Simone cake, Barbara barbecue chicken, Antoinette fried chicken, Mercedes. What kind of chicken? What kind of chicken? What kind of chicken you bringing? What kind of
I'm thinking about jerk chicken.
jerk chicken? All right. Right. So just bring the cake. Just bring 2 cake. One for me.
I'm bringing 1 cake. So who bringing plates?
Did you give the lady money?
I don't know. Not yet.
We're gonna
All right.
make plates of stuff.
All right. So
Somebody
far.
give me the money I buy because tomorrow I'm gonna go buy.
Okay.
I'm bringing my patient to work. When he works, he said a dollar to.
Oh, nice. Okay. So far we have 1, 2, 3, 4, 5, 6.
Look here, you can get a
We have 6 participants. We have 6 participants right now. Okay. You guys are real quiet over here. Can I get some participants from this side, please?
Sorry. Look here, guys.
Sparkling cider. Spell your name. Spell your name. Spell your name. Sparkling cider. All right.
I would like to have some french fries. but
What about
I
you,
would like to
Sandra?
bring it hot.
Why?
Yes.
What about
I'll
you?
order it while we're here. They're gonna bring it hot.
You're not gonna be here. All right.
I'm gonna order it the proper way. It's good. Everybody.
All right. So far, so good. So far, so good.
So maybe we don't have to cook. Maybe we can just put together.
We need fried rice.
What happened to
No. I wanna use your hand.
Huh?
no rice.
No rice.
Is
They
that-
said no rice.
You love rice so
Maybe we
much.
can.
Yes, I love carbs. I love carbs.
I'm looking about it. I don't eat
Fried. We
rice.
need
I don't make my mommy.
we need fried rice.
I don't just do it with the sweet sauce. I cook it first.
True.
What happened? What happened?
Huh?
I said that. I said we should bring some patty. Somebody order patty.
Oh, beef patty?
You don't pour it on me. Yeah, you.
Beef patty? Okay, Sandra, beef patty. Sandra, beef patty. Okay, somebody got to bring beef patty.
Bring,
Patty.
bring the saltfish one and the spinach one.
I already got you on the list already for
Ikea, what
for
are
fried
you
chicken.
bringing?
Huh?
What are you bringing?
Me? I'm bringing Belize. I'm bringing Shandy, and I'm bringing no Corona. Just Belize and
Don't
Shandy.
bring any alcohol in here.
Belize is not alcohol; it's wine.
Saltfish and chicken.
Baileys is rum cream.
They have a spinach. They
It's
don't have
what?
it.
Yeah, Belize is fine.
No alcohol.
Belize is
Where?
fine. Belize is
Right
fine.
here. Belize is fine.
I bought a flatland, no strand.
Look here. Let's tell Mr. West first, okay? Let's tell him when you come here.
No.
We can't tell him. We have to surprise him. Yeah. They don't tell him nothing. They just surprise him. Yeah, we gotta surprise him too. Yeah.
No, he's not.
He's not gonna do that.
Yeah.
He
He said no.
always said we don't do anything.
He said we were a boring class. Remember?
The last time he said we don't do anything. No. The last
Yeah.
time he said that.
Yeah, he the same.
Yeah. No, I'm telling you, he did say that the last time.
Yeah, he did. Yeah.
The other class, they got
Yeah, he said we're a boring class.
No, but he's like, he was saying that we are the only class that
So, Barbara, so you bring her, because I'm bringing a table.
All right, so we got.
You guys want a real table book or plastic?
No, plastic.
All right, I'm gonna post it on our WhatsApp
Yes, tell
real quick.
me what you put me to
I'm
put.
posting on our WhatsApp.
What I'm
What?
gonna-
No, you gotta tell me what you're gonna get. You didn't.
No,
I
no,
just.
no, no. I'm
You
not
didn't
gonna
put-
say everybody bring chicken. I'm not gonna bring chicken. I'm gonna bring carbs.
Okay.
I thought you said you were making money.
No,
No,
bring.
not me.
No, you said that. No, not that she said. No. They never said she gonna order fries. I'm gonna put shrimp on it because some people want fries. You told them that.
Yeah, anybody allergic? I'm not allergic to shrimp. Anybody allergic to shrimp?
No, some people are.
Some
Nobody.
people are allergic to shrimp. I'm not gonna add shrimp to it.
Okay, bring salmon. What about salmon?
I am highly allergic to seafood and shellfish.
That's
Oh
okay.
Lord.
And then somebody's gonna eat it, and then they're gonna touch something, they're not gonna wash their hands.
So no seafood.
No seafood.
No seafood.
People are allergic
So
to
Nadesh,
it.
what you bringing? You're bringing
Rice.
rice. Good.
No party.
Rice and
I'm not
rice
going
and stew.
outside because my shoulder don't tell me when it's gonna hurt.
Bring black rice. Black rice. Black rice.
I always have my
That's
mash
Haitian.
open.
Haitian rice. Haitian rice. Stew pork. Who's bringing stew? Okay, that's it. That's it. We add the list. That's it.
Even it's killed me, I like it. When I eat pork, forget about it, my belly going upside down, but I still eat it.
All right. So we set. For tomorrow. That's it.
I still don't know what you're bringing in here.
I said I'm bringing Bailey's.
I said
Huh?
Seriously, there's no drink.
bring dinner roll.
No drink.
You don't want him to get upset. No, don't do that. Bring dinner roll, bring water, bring juice.
Yes.
Come on.
Why we let
Don't bring anything.
All right. I'm bringing.
Hey, ume masandra, kiso pote.
I'm bringing
Eh?
I'm bringing Shandy.
What about sunshine?
Oh, Shandy.
Jacques, grâce à Dieu, merci.
Shandy's acceptable.
Diane's men remember but.
Oh, okay. Otherwise, I just bring
Something
I bring
nice.
Poland Spring. I bring a pack of Poland Spring. So does the worst. You might as well drink Bailey's and drink soda.
Depends on young people.
So does worse.
Anybody bringing dinner roll? Bring some dinner roll too, you know?
Okay. Let me go through the list one more time so everybody know.
You know those dinner roll? You know those Hawaiian?
Good morning.
Evening. All right. So
Whatever you want it to be.
Does anyone want to make payment?
Yeah,
After the
okay,
New Year,
Why don't you wait for February with the taxes and we'll be ready? When tax season, we're gonna just leave up the money and bring it to you.
Huh?
Top shit as social professor, you can pick class.
I swear, shaking. I'm on the game. Wale, swallow. Ah.
okay.
All right, guys.
Oh,
Hey!
on, guys. Come on, let's go.
So seriously, guys. No?
New Year's.
Okay.
Christmas.
Okay.
All right. Please pull up your image of your GI system. So we're going to be taking it from the mouth to the system. I'd ask you to look at your enzymes. Look at your common bile duct, your liver, your gallbladder, all that's involved in your GI system. So we should not have any concerns right now because we did this before and we just had a quick review so we can get into the pathophysiology. Let's say that the digestive system, which is also known as your what? Digestive system, or what else?
Alimentary canal.
Alimentary canal. And it starts at the
Mouth.
and at
The anus.
in the mouth, which is also known as your the mouth is also known as your oral cavity, also known as
Oral cavity.
the buccal cavity. So in your mouth, you have teeth. How many of them you've got?
Okay. Some of us have less.
Definitely some of us have, including me. I got partials, so I got less. I'm hoping one day one of you can give me implants, and then I'll be good. But at this point, I don't have that type of money.
Big time money.
I'm just a poor man who's struggling.
I don't want to spend it.
Maybe I spend the money out of it. I ain't got nothing to leave, that's the thing. Alright, so you have your mouth, and there you have your teeth, and you said 32. But it's not just 32 teeth. And just let me remind you, when you're doing your inspection of the mouth, you go by numbers. So please refer to your chart that indicates the numbers of the teeth. Okay? They do not go by this is this type of teeth or that type of teeth. They go by
Numbers.
numbers. Number 1, 2, whatever. So please look up the numbers for your teeth. Now we know the teeth have different functions based on their location. So what are the different types of teeth we have? Incisors. Where are the incisors located? Stop the noise. Where is the incisors located? Everybody close your mouth. Take your right hand up. Close your eyes. Now where you think your incisors is, put your finger on top of it. Close your eyes. Lord have mercy. I can still keep it. All right, take your hands down. The incisors is in front of your mouth.
I
Now,
got
what
it.
is the responsibility of the incisors?
For cutting.
Right, so you're biting a banana, you don't put the banana to the side, you go what?
To the front.
Because it cuts the banana. Right? Then what's the next one you have? No. What's the next?
Canines.
Canine. Close your eyes and put your fingers on your canine. Lord have mercy. Canine. There's people who call it eye teeth.
Yes.
They're the
They
one
call
that
it
is
dog
pointed.
teeth. Yes, they call
And
it
the dogs.
Where's the
dog
canine?
teeth.
We got the dogs.
Yes, the
The dogs
canine.
are canine. The dogs are
Canine.
known as canine.
Yes.
Like the canine
Just
branch
different
of the foot.
pronunciation. The molar.
They ain't got no vampire.
Mm.
You got canine too. You got canine dogs.
Canine.
But what they write it for the police, they put a K and a 9. But the spelling is C-A-N-I-N-E.
Canine.
Canine branch.
Yes,
Canine dog.
canine.
So what?
You
Canine.
say
That's French.
Yes.
All right. Canine.
Yes.
Now,
English.
That's
what's the
all.
function of canine?
To grind.
No.
No.
To what? No.
To rip.
To tear.
Yeah. Rip,
That's
tear.
the word. Rip, tear.
Okay.
Rip is like this.
Yes. And
Tearing is a different action.
Okay.
All right?
Okay.
Now, ripping, you're ripping papers.
Mm-hmm.
You don't rip meat.
Molar.
You tear meat. You tear flesh. You don't rip flesh. You rip
Molar.
papers, newspapers, you rip it up. All right? So now we have the tearing. It's like you're going to bite a piece of what?
Meat.
Popeye chicken.
Yeah, chicken.
So you don't put it in front, right? What you do, you put it to the
Side.
to rip it.
Yes.
You put your canine into it and then you throw away your hands. Because you're going to turn it away. Then next you have what?
The molars.
No, you don't have premolars. You have premolars. And another name for the premolars is what? Bicuspid.
Bicuspid, yes. that's right.
Bicuspid. And then you have the
Tricuspid.
molar. Okay? Grinding and chewing. So that's your teeth.
Let's run through that one more time. You have the
Incisors,
incisors, the canine,
The canine.
premolars,
Yeah, the
and
premolars.
Bicuspid.
bicuspid.
And
In
the
all, you should have
molars.
32. And then in your mouth, the oral cavity or the buccal cavity, you have your tongue. You have your palate. And you have your lips. And you have saliva.
Salivary glands.
So you know that. So let's start with, because we said we do pathophysiology. So we just spoke about the normal. Stay with me, Miss Professor. We spoke about the normal, right? The normal feet for the two of them. What do you know, or what do you think people complain of with their teeth?
Toothache.
Pain related to what?
Cavity. Cavity.
Related to the gums.
Caries.
Dental
Or
caries.
dental caries.
Dental
Or gum
caries.
disease.
Mm-hmm.
Because cavities in itself come from your dental caries. Alright? So dental caries, some people call it rotten tooth. Right? Rotten tooth. And you have a hole. But what you want to know is, how does the teeth get rotten? How does the teeth, or what is responsible for the teeth getting rotten? Poor hygiene. So, lot of sugar.
Blood sugar.
Lot of what? Not
Yes.
eating the teeth.
E la moun yo gen problem tout gom yo konson. Oh, okay, madam.
Why? Why do you want to get a food out from your teeth? How the food's going to make you get rotten? What does the breaking of the food has to do with your rotten tooth?
When it's sit on the night, when you
The same bacteria, what the bacteria has to do with it? Don't say I don't know this class. So I will find out. I will find out. Remember when you guys working?
Yes,
And the
I will
state comes
find
in,
out.
what did your instructors tell you on the job? They tell you not to say, I don't know.
So let me
Okay,
get back
and
to
you guys know that. So in this classroom, the same thing. Don't ever say I don't know.
If the food,
Let's try to find out.
It's when
So
food.
what causes the dental caries? We hear in sweet stuff, we're in the food.
Well-
All right, but how does this food cause a problem? Young lady said,
When
the
it sits for
bacteria.
a very long,
So how does it cause a
time.
problem?
When it sits
When-
for a long time and then you don't
between your
flush
teeth.
So when it sits for a long time, what happens?
it builds caries.
How does it build? The food's staying there. And the food.
You
And here.
wash
How
it
am I
then
causing problems in here?
because when you brush your teeth, you don't wash
Stop.
it.
You're not answering the question. You're going out to where? I am the food. I'm just said sit for a long time. I'm sitting here for a long time.
It starts,
How am I just
It
messing
starts-
up here?
Mr. West,
I said it.
the food starts to decay.
Breakdown.
All right, the food starts to decay. How's it messing up this?
It's gonna produce acidic,
What's acidic?
um,
Read it over there. So read it.
it's called
When you have a dental caries, the
metabolic-
problem is due to the fact that you have food in the mouth, and because the food now attracts what? Bacteria, and the bacteria now releases acid, and the acid damages your enamel. Enamel, that white coating of your teeth,
Enamel.
it's called enamel. So the acid what? Burns through that, and the acid is being produced by the bacteria. The food is not the problem. The bacteria is the problem. Because if you don't get the bacteria in there, your mouth will smell bad because you don't take out the food.
Okay.
But it's not going to damage your teeth. But if the bacteria come now to have a feast on the teeth, they now start to do what? Produce acid that damages your teeth.
Teeth. Mm-hmm.
That's why you have to what? Floss
And
that's why you have
brush.
to brush your teeth.
Mm-hmm.
That's the reason. Okay? Are you guys pre-understand what's going on?
Very much.
So when you get this dental caries now, the acid it start to damage your enamel and start to create what? Cavities. And when you start to create cavities, it leads to other things. But as you know, patients get what? Toothache, right?
Mm-hmm.
Because they have a cavity. So what causes toothache? That's still not getting it there. What caused it? What caused the toothache?
Bacteria.
The bacteria caused the hole. But what?
Acid.
Huh?
The acid.
The acid from the bacteria caused the hole, but what is causing the pain? Nerves. Pain is always nerves. So you have the nerves because people got a hole and they're eating, they got no problem. Until one day, the hole goes a little more deeper than it should, and it touches a what?
A nerve.
And that's when you drink some cold, oh gosh, or you drink something hot, oh Lord, they're gonna. The nerve. So when it starts to touch the nerve now, what do you think is going to happen? The pain. And then what do you think is going to be the resolution from the doctor's point of view?
You gotta,
They're going to talk about two things. Save the tooth or extract the tooth. The first one is where you come in a lot. Because you will be coming in on the first one. You could be telling the patient, brush your teeth. So that you will not have the bacteria that will continue to cause the hole to get bigger.
and mouthwash.
You're going to also tell that patient, right, that whenever they have pain, what they should be doing. You should be advising this patient on the type of analgesics that they should be using. All right? Trying to avoid the NSAIDs because a lot of people said, let me take a aspirin. That's a problem.
Why?
That's a huge problem. Non-steroidal anti what?
Non-steroidal anti-inflammatory drugs.
Causes a problem. And when you get into your heart conditions, you're going to know a lot more about it. But it also causes a problem with your stomach. So when you use the aspirins, it causes a problem with your stomach. All right? So you don't want that to happen. Also, aspirins are what? Blood thinners. So there's a lot of reasons why you don't want to use aspirin. Right? The person having what triggers the pain? I've been eating. So when they're eating, the food's going in the hole, and that's causing the pain. So you say, until you go to the doctor, you better chew on the other side. Because when you chew on the right side, the food will definitely go in there. It's not going to protect it. And you will get pain. Now the extraction, you have to go to a dental surgeon. And I didn't know that not all dentists take out teeth. You got a man named a dentist, and you said dentist, as you know it, he pulls out your teeth, right? Your tooth. But when you go there, he said, no, I got to refer you to somebody else. And all the man just put the thing in your mouth and pull it out. And you see why he could do it? He's a dentist. But you got to go to the dental surgeon. Why? Because this, in America, he getting paid. And when you refer to the dental surgeon is getting paid.
Okay.
So two people are getting paid.
Okay.
Back home in where you come from other country, you go to the dentist, oh, no problem. And it's out. Here, I'm not a dental surgeon. So what the hell you do?
So he refer you to a dentist.
Oh, I do fill-ins and I do, that sort of stuff. But I don't pull it out. Pull it out is only for the
surgeon.
So two people get paid. And that is how the American society is made up. It's all about money and passing it from hand to hand to hand. So you end up paying, or your insurance company is end up paying a lot of money. So how does the insurance company stop this? How do you think the insurance company stop going from dentist to dental surgeon?
By having them all in one building.
No. The insurance companies put you, once you're with the insurance company, they give you something called a wellness program.
Yes.
And with the wellness program, you get free dental checkup twice a year. If you got free dental checkup, meaning the insurance company is going to pay what? $50 for you for them to check your teeth. So they'll pay $100 for you for the year. But if you get a tooth problem, where they have to what? Pay for
surgery.
Root canal
to fix it. Whether it is to put in fill-in, whether to extract it, they're going to pay what?
thousands.
A whole lot set more money. So if they pay $100 for you for a year, so you go and check your teeth and keep it clean, they're saving thousands and if you add up, millions of dollars around the world. Okay? So everything has its reason. Okay? So now, the second intervention is that they can pull out that nerve. And pulling out that nerve is called a root canal. So they go in there, and people hate root canals, right? Because the mere fact that they have to numb, the numbing and the sticking and the sticking and the numbing, and a person like me, I got to get like 20 shots before I can start not feeling anything. I kid you not. They're going there. No. I'm still feeling it. Yeah. Zeke. The last time I went to the dentist, she gave me at least, and I'm not kidding, I'm not exaggeration, 8 shots. At least 8 shots. She stick. She go, are you feeling? Yeah, I'm feeling. You feel so? Yeah, I still feel something over here. Alright. Get you come alright, you should be alright now. Hold and start to drill and out. Hey, I'm feeling pain. Stop. She go back in. Alright, you're gonna be alright. I'm still feeling. How you still feeling? And now she starts sticking me all over like that.
Oh, Jesus.
She stick here, she stick behind, she go around there, and she just keeps sticking. And I said, I'm feeling it. I'm feeling. Every time she put the thing on my teeth, I feel. And she wasn't pulling out. All she was trying to do with her was make it numb so she can do fillings. But that's what it is. Some people have a very high pain tolerance. I have very low pain tolerance when it comes to my mouth.
Me too.
I got pain tolerance all over my body. But when it comes to my jaws or my teeth, mine is like the lowest of low. I think everybody else have low pain tolerance when it comes to their mouth than me.
Give me general anesthesia. Do what you gotta do.
I did. Once I had
Mr.
some
Wayne.
tooth work done, and I let them put me on the general anesthesia. Knock me out.
Yeah,
Do your stuff, then wake me up.
me too.
That's it.
But if they do the wrong one.
What?
If they do the wrong one,
Then I sue them. I get some money.
oh, okay.
That's right.
But some people have the worms there too sometimes. Worms.
What's that?
Worm.
Or rum.
Worms.
Warm or rum?
Oh, worms.
Or worms.
Worm, like the worm.
Rum, like a drink?
Not worm. Not worm. Worm.
Or warm. W-O-R-M.
W-O-R-M.
The thing that's wiggles.
Yes.
Yeah.
Look at the image.
Worms can be
Yes.
all over your body. We talked about this sometime before. When we said wherever blood goes, worms will go. And worms migrate all over your body. So that's not a
Remember when you used to take the
but it's not the worms is not gonna be in the tooth. Guys, worms is not in your tooth.
It's in the gum.
It's kind of get in the teeth. How it's gonna get in your teeth? You have hard enamel around it. It's not in your tooth. It's gonna be in the gum, in the roots, as you said, but it's not gonna be in your teeth. Because it can't get into your teeth.
Okay.
All right. So we can do the root canal, and you know the nursing consideration. The very first thing is what? Pain. Right?
Yes.
After pain, what else you gotta think about? Come on, now you're doing at 5.
Infection, right? Yeah, infection.
At risk
I
infection,
agree. I agree with that.
based on the fact that we pull out the tooth. Right? Well, that inflammatory response is infection. Of course, there'll be a risk of bleeding gum based on what is being done. But think about the patient. There you go. First thing patient is going to complain of pain. And then the first thing going to make them come. Then next is going to be what? They can't eat. So you got to think about what? Changing their diet to be a mechanically altered diet.
Soft.
Right? Or they're going to have the patient losing weight.
Yeah.
Dental caries. What else can happen? Bad breath. Halitosis. So that's a 3 nursing diagnoses you have right here.
Pain.
Pain.
Infection control.
Pain. The patient is unable to chew, so he's having problems with eating.
Dietary modification.
And then you have number 3. Every time the person talks to you, you got to turn away because of mouth smell. You ever talk to somebody in the mouth smell? And you ever have to take in the breath and like, you don't want to tell them that their breath smells, so you take a deep breath. And you just turn your face to the side and then we control your hormones. If you go down, you're not going to trouble because you're going to hold your breath for a long time. All right. holding the breath for person, you gotta be very tactful. You can't just say, man, you got bad breath. Because some people will become what? Upset. I may want to knock you out. Alright? So you gotta be very tactful. You gotta maybe like, what do you have to eat today, girl? Oh, I ate whatever. You think I can smell that thing? Hopefully they'll check again from that.
Or you can take them to CVS and buy some new brushes.
No. That is that'd be very tactful.
Or you ask them what type of toothpaste they use so you could switch it.
Yeah, you can do that too. What time? Maybe that toothpaste you not with them. Some people might get upset.
No, that's telling them. I think the best way also is to and then you go in that situation if I tell you. But that's not gonna help the problem. That makes it worse.
The problem is that you have to get rid of what? The dental caries. When you get rid of the dental caries, you get rid of the problem.
Of course.
Alright?
You're gonna ask the patient when was the last time the patient see the dentist.
Okay.
That's you can start by saying that. And then when you went to the dentist, what did the dentist tell you? What happened? What kind of toothpaste did the dentist prescribe for you? That's a way to approach it.
The dentist prescribed what type of toothpaste?
Yeah. Nice shoe dentists do give you sometimes what
They may give you a floss, something.
they give you
They
mouthwash.
do mouthwash. They do
Well,
mouthwash.
whatever the situation, you cannot say because it depends upon the type of situation that you have encountered and what type of situation, whether you are a professional person to that person working in an area where that person is a patient, or that might be a friend, might be a family member, might be your date, might be your husband, might be your wife. It might be somebody.
If it's a date, you leave it right there.
That also can create anxiety and depression.
Of course you can get anxiety if you tell the patient. Because many times people have bad breath, they don't know that they have bad breath. Many times people aren't smelling, and people smell funky, and they don't know that they smell
People
funky.
are used to their body
Because
odor. I don't know
exactly.
how their body
So
odor.
if I'm not your friend, you going outside. If I'm your friend, I'm gonna pull you in the side. You could take it as you want to. I'm not gonna tell people, but I'm gonna pull you in like this.
No, that's your friend, but as a patient, I can't tell the patient that. Because the patient has anxiety.
I'm gonna tell them how long they take a shower, if they would like me to pet them. When they say this is what I do, I tell
And you
them
can,
come.
you can end up
I say I'm bringing nice food for you to wash.
yeah, you can talk to the family about it.
Night, I take them in one.
Okay, so whatever the situation may be, the patient with halitosis is related to dental caries can be a concern, but it can be easy, as some persons have indicated that you can easily give that person some mouthwash or something, but that is not going to take away the problem. That's only going to be a temporary fixture. Okay? All right, so chewing is a thing. We talk about the chewing, we talk about the dental caries. What else can happen to the teeth?
Get yellow.
Decay.
You can get a yellow teeth. What is yellow based on?
Coffee
Plaque,
stain.
right?
Coffee stain.
Plaque. So let's see what plaque means. Now, there are two types of plaques. The one that you hang on the wall. That is appreciation, birthday, whatever, that's a plaque. And then the plaque in the teeth. Guess what? They both are spelled exactly the same way. So it's where and what situation that you talk with plaque will tell you what you want to do. So plaque, what is plaque? Come on guys, we gotta move.
Sticky film of bacteria that constantly forms on teeth.
So the plaque that is on people's teeth has a lot of what? bacteria, and this is the same bacteria that cause what? The cavities to form. So when a person have plaque, you know they're at high risk for dental caries. Now, now, with this plaque, you could have people having, as we said, you could have a discoloration. But a discoloration of the teeth can be due to what? Smoking, drinking coffee. There are certain things that you can be eating and that can cause discoloration of your teeth. But coffee and smoking, two things that definitely cause problems. So you want to drink, you want to what? Do your mouthwash to clean the teeth, right? After smoking. But then the best, what do you think you should be telling the patient? Not to smoke because so many related problems. Most of all, if you're living with somebody, or family member, or whoever, a friend or something like that, don't let them smoke around you. Because secondhand smoking is worse.
It's worse.
Actually smoking.
Yeah.
So you don't want them to kill you. And they say, look at me, I'm still alive and you got all kinds of problems. Yeah, because they give it to you. All right. So you can have plaque. Now, what else can happen to the teeth? Don't move from the teeth. You just cover the teeth right now. What else can happen to the teeth? No, I said the teeth. Oh, no, no.
Weed is free now. It's legal now.
Smoking weed. Baby's gonna be bright.
But it's legal now. It's legal now. It's legal.
Weed is not like tobacco. I don't smoke, by the way. Because people see me got this thing from my head, it's a rascal. I do not smoke. But what I'm saying is that weed has been used for medicinal purposes over the years. And I don't think she smokes a whole lot of weed, and I hope that. Because she's going to get a kid high.
4 times, 3 times a day.
Well, she's going to get a kid high, the kid's going to grow up on weeds. And that may be not a good thing. Because when you do a lot of weeds, sorry.
She said she went to see the doctor last time. She said because she cannot eat if she don't smoke. And I tell her, it's in your head. And she goes, no. And I spoke to her and I said, you need to go see a doctor because she has a lot of depression. When she spoke to me, she said she wouldn't feel herself sometimes because she's here alone. And then she was married to someone, the person wasn't here. She don't have no family here. So I met her to my job. And then when she come and talk to me, and then she told me like she's smoking around the baby. She told me I take the stuff for her because I don't want her to smoke around the child. The child didn't talk because just started to talk like I would say 2 months ago.
All right. So that person should be referred to a social worker.
I don't want to be that person.
Huh?
I don't want to be the person to report her.
Not report her, refer her. You're not reporting what she does. Her problem, as you stated, her problem is that she feels she don't have any support because whoever brought her here has pretty much dumped her and leave her in a situation. So now she has a kid. They have organizations that will help her.
Yes.
Okay, so
Women organization most likely.
she just might have, as you said, a mental problem because they have too much support out there she can get. Lots of support. So, all right. So what else with the teeth? What else can happen to the teeth? Loose shaking, teeth shaking. That be due most times due to trauma. Person getting hit. What else can happen to the teeth? Well, you can get loose teeth. You can have broken teeth. Right? But that is trauma, right? What else can happen to the tooth? Tooth what? Tooth infection. So I'm going to go different. Let's start tooth impaction. Look, impacted tooth. Impacted tooth.
Define impacted tooth.
The word impacted tooth is a disorder in which a tooth is so crowded in its socket that it cannot erupt normally.
Oh wow. It says the definition of impacted tooth is a disorder in which a tooth is so crowded in its socket that it cannot erupt normally.
I see some people later on in life, they got a tooth discomfort from the push up from the side, right? Cause them problems, discomfort. It's just what? Remove it. Or you can have impacted tooth. All right, what else could happen to the teeth? Sensitivity. Tooth can be sensitive based on nervous, neurological situations.
It squeezes up too much.
Okay. Well, what else can happen directly to the teeth? Yeah, some people got space in their teeth, right?
Yes.
Some people think it's very sexy, have a nice space in front of the tooth in front.
That is sexy.
It is sexy.
Yeah, it's very sexy.
All right. I guess some people think it's sexy.
But you know,
So,
like,
also,
the gap is.
I don't get it. You said so. It's a problem when people have.
You mean a
this
gap?
No.
My sister have that. My grandma have that.
People having a gap.
It's genetical.
Yeah.
It's genetical, no?
Persons having gap in front of their mouth too. It depends upon how wide it is. Right? Some people think of it to have body image disturbance because when they smile, don't be a problem. They may have what you call crooked teeth. And crooked, put it in too so you can see crooked teeth.
What is crooked teeth?
Here's what I found.
CROO, like crook, which is a gangster, a thief. Or robbers called crook. You are a crook. You're like this.
What is the medical definition of crooked teeth?
Crook teeth, that's it.
I found this on the web.
Do you see crook teeth? Yes. All right. But it's some that can come on the Right, that's why I was saying.
Is that a problem? Is that a
Heart is a problem. But they also got the problem is people looking at you, but it's not going to prevent you from eating.
So if they can cause decay because they can't get the cleaning between the teeth properly.
It depends on the size of the thing. Toothbrush can go there or not. But in this modern age, that's way back in the days. In this modern age, you got water pick and all kinds of stuff. And they're cheap now. Water pick, anybody can buy a water pick. Even at the 99-cent store.
They can also interfere with chewing and cause vegetative symptoms.
So again,
Can also interfere with chewing and cause vegetative.
it depends on what type of crooked teeth you have. Alright, so crooked teeth is definitely a problem. Some people, you ever see some persons with their teeth going in all different directions? Right? And it's the sad part about it can be fixed. When people have some problems, when their teeth are out of alignment, normally they give them what? Braces.
Yeah.
To correct it. But when you're from certain countries, you don't have that what? Opportunity. Because you don't have the money. So people have this going all over the place. But what they do have is organizations, especially church organizations, that will ask for money to help these persons. Alright? Alright, so that's it.
And what's your fault?
I'm not what you guys do. You guys are too what? You're talking too much. At one time you're very quiet, you used to talk. Now you're talking a lot. Share, yeah, share. Share in the class. Alright. So what else in the teeth that has a problem? What's that? Can't see teeth. All right, let's stick with the teeth. No, let's go cancer. Let's go something else. What else can happen? Come off your phone, please. What else can happen? All right. When you look at the teeth, you can get something called a notched incisor. So look for a condition known as Hutchinson's teeth.
Define Hutchinson's teeth.
Hutchinson's teeth. Hutchinson.
Define Hutchinson's teeth. Look up Hutchinson's teeth. It's not. Look up Hutchinson, Taeeth.
Whoever find it, just read, please. Somebody just read.
Look up Hutchinson's, Teeth.
Which occur when a pregnant mother transmits syphilis to her child in utero or at birth. The condition is noticeable when a child's permanent teeth come in. This incisor and molar take on triangular or pick-line appearance.
Now if you look at you can see pictures of notched incisors, right? So this is usually when a woman
Hutchinson's teeth.
who had syphilis, which is sexually transmitted disease. And most women don't know they have. That's the unfortunate part about it. They don't know they have syphilis. So, unless they have the test to check to see if they have syphilis, the child will come out with problems. And one of the problems the child will have is that after they get rid of that baby tooth, or the baby teeth, and they start getting their permanent teeth, now you're going to get what? The teeth have the notched incisors. They don't happen to the baby teeth. It happens to the permanent teeth.
That's messed up.
And in this case, if the person has syphilis, there is no way, as you know, like when people have AIDS, right? And you're pregnant, they don't let you have like a natural birth. They usually do C-section for you so that you don't pass the AIDS to your kids. So in this case, there's nothing they can do to help that patient transmit.
Like how do they identify it ahead of time? How can you identify it ahead of time? But you just said that you just said that she would not even know. So how would she know to go do the blood test? Or does it? Or would it show up? It would show up during the blood test, right?
There's a way they can help that patient, just like they help patients
Look,
with
they
AIDS.
can do blood tests when a
Mm-hmm.
patient is pregnant to see if they have syphilis.
Right.
After doing the test, the person could go and have sex and get syphilis. And during the actual birthing process, it could be a problem. It's just as much as when a person who have herpes, they cannot have vaginal birth. Once the mother has been identified with herpes, they're going to do cesarean section. But that's herpes, and they pick it
But
up.
this one, either they do
Right.
C-section or a natural birth, the kid's gonna have
This
it.
kid is going to have it, so it's just one of those into the blood of the patient. Alright? So once it's within the mother is pregnant, you know, most of these things happen during the second and third trimester of pregnancy. So although they might have had a test and comes up negative, the patient can be positive. A lot of times most women do not know they have syphilis. It's just like they don't know when they have gonorrhea either. So they pass this on to the baby ends up with Hutchinson's teeth. Right. So that was just the teeth we were looking at. Now we go to the gums. And the gums, everybody know gingivitis, right? Gingivitis is inflammation of the gums. What causes inflammation of the gums? So what you want to do is put list cause of gingivitis.
List the causes of gingivitis. You real sleepy today, Mr. West.
I was up all day doing that. You would not know it. If I tell you from last night until today, not much of anything.
Healthy gums are firm and pale, pink, tightly round. Signs and symptoms of gingivitis includes swollen or puffy gums, dusky red or dark red gums, gums that bleed easily. You said causes, right? Causes. Okay, causes. The most common cause of gingivitis is poor oral hygiene that encourages plaque to form on teeth, causing inflammation of the surrounding gum tissues. Here's how plaque can lead to gingivitis. Plaque forms on your teeth. Plaque is an invisible sticky film composed mainly of bacteria that forms on your teeth when starches and sugars in food interact with bacteria normally found in your mouth. Plaque requires daily removal because it reforms quickly. Another one is another cause is plaque turns into tartar. Tartar. Plaque that stays on your teeth can harden under your gum line into tartar. Parenthesis, open parenthesis, close parenthesis, calculus, which collects bacteria.
Stop with that phone. Why are you choking yourself? No, it's suicidal attempt in the classroom.
Need CPR?
Calculus. Where you heard the word calculus before?
Bone calculi, yeah.
Calculus is stones.
Yeah.
Renal calculi or renal calculus is singular. Renal calculi is plural. Not a calculus, same spelling as a math.
So calculus is more.
Is stone. Right? That renal. And the calculus, another name for calculus is lithiasis. Alright? But that's just, so you're going to have this tartar under there, which is because it hardens. The same film, which they call what? What's that film?
Plaque.
And this plaque now gets under the gum and hardens. And because the gum hardens, because the calculi is a stone, right? So that becomes hard under there, and that creates a problem. That's how you get there. One of the causes of
gingivitis. Continue.
Remember, as we go along, guys, I want you to understand why things happen. What caused it? Don't just say plaque caused it. Say how the plaque came about. What is plaque? Most people say plaque, I don't know, it's something for your teeth. But you know it's a film of bacteria. And if you don't take it off every day, it will just build up because it reforms quickly. After you finish brushing your teeth, by this evening, the plaque is back. And if you don't brush your teeth, the days and days, the plaque will what? Build up. Then it gets onto your gum. And then that leads to tartar, which is the harder stuff.
Right.
And then next thing you know, you have what?
Gingivitis.
Because you got all these bacteria up in there. Only thing them bacteria do, they need to eat and live. There you go. Alright, so the gum becomes swollen. And what are the signs of inflammation?
Pain.
Pain.
Redness. Swelling.
Heat, which is getting hot with temperature. And what's the last one?
Fever.
Guys, you know what I'm gonna do? Go take a walk and look at that nice legs over there and come back. Because I know what's wrong with you guys. Loss of function. How the patient's gonna eat? Come
Come on.
Yes,
The
this is the first
inflammation,
thing.
inflammatory response, loss of function. That's one of the inflammatory. You get, oh yeah, pain, definitely.
Inflammation.
You got swelling.
Mhm.
That's two you already got.
Heat.
You got
Redness.
red, the bug got swollen and red. That's three. You may not get heat, but you get what?
Swollen.
Patient can't feed themselves
Yes.
because of what?
Loss of
Pain.
function. Mhm.
So you have loss of
Function.
function. And those are the five. Guys, don't forget inflammation because inflammation comes in every part of the body. If you get the inflammatory response in the eye gets what? Conjunctivitis.
Swollen.
Red.
Swollen. Heat. Loss of function.
But then start lose function, which is what? You
Sight.
start seeing blurry.
Mhm.
So loss of function. Come on, keep that there with you all the time. Those five, you should remember it all the time because it comes up in every disease process in your body. That's how you the nurse will identify what's going
Loss
on.
of function. Pain.
You don't have to know those five. And once you know those five, everything will just flow. When you see a person stamp their toe,
Loss of function.
you see toe gets what?
Heat.
Swollen, right? Next thing they can't walk. So what I tell you?
Loss of function.
And loss of function is a big one there. So apart from being swollen and pain, you can't use the toe like how the normal people do. When we put up with what? Loss of function. Guys, don't forget it.
The
Please.
last one is
Please don't forget it.
loss of function.
So that's a gum. Now we just the teeth, or we the gum, right? And you can get some other stuff happening going on in the mouth.
The last one.
So we're gonna go with and look. Sorry. What cause a gum to be in what sense? So what happens with the inflammatory response? See if you can work it out. Really quick working through. How it don't cause. Inflammation, guys, by the way, is a response to what's happening. It's just like when you get yellowing of the skin, which you call jaundice. Jaundice is not a disease. Jaundice is just a what? A sign of the disease. It is not a disease. Right? So when you have a person having bleeding, what is it? There's got to be deterioration of the blood cell. Because the walls of the blood cell has a problem now. So you have blood escaping out of the blood cells. Remember when it reached down to that level, you have what? Your capillaries, which are very tiny.
Mhm.
And if you have bacteria that can cause your enamel, that hard stuff, to get what? A hole. What do you think about your blood vessels?
Gonna burst.
They're going to
Burst.
cause damage.
Mhm.
They're going to cause damage. Not really with the burst. They can cause openings and cause bleeding. Guys, all put together. This is what I want to do. Periodontitis.
Periodontitis. Periodontitis.
You have a specialist. The dentist, he said he specializes in what? What does the doctor dentist specialize in normally say? One of the things he says, periodontics. If you look at what is certified, periodontics. Look for the word periodontics, please.
Look up periodontist.
Periodontics. Not periodontitis.
Periodontology or periodontics is a specialty of dentistry that studies supporting structures of teeth, as well as diseases and conditions that affect them.
All right, so that's your periodontics. It's related to the study, understanding what goes on with your teeth. So he's a dentist that specializes. So when you look at their, behind your names, you got things that they specialize in this or what have you. So periodontics is one of those. Now, in the mouth, you can also now have an inflammatory response. Sometimes kids get thrush, right? Thrush is caused by what thrush?
Look up thrush.
What is thrush? I'm talking about bacteria. What is thrush? Guys, look it up.
How you spell it?
Oral thrush.
How you spell it?
Baby thrush. Anyone you want to call it.
How do you spell it? How you spell thrush? THRUSH. Mercedes.
Not T-R. It's T-H.
Mercedes. How you spell thrush?
All right, somebody please read what thrush is, please.
A fungal infection, typically on the skin mucus membrane, caused by
candidiasis. It's in the mouth. Mucous membranes is in your mouth. So you have this problems of babies get it. Oral thrush or oral candidiasis. And so a yeast-like infection, right? Cause of oral thrush. List cause. Antibiotic use, prolonged antibiotic use. What else? Go. Let me hear.
STD.
You're putting things in your mouth that you're not supposed to put into your mouth.
There you go. Weakened immunity.
People think that oral sex is a fantastic thing. Yes. It's beautiful. But it's not beautiful when you have people with certain things.
Diabetes causes it too as well. Vaginal yeast infection can cause it too.
All right, so yeast is a problem, okay? So yeast, and we go, what is yeast? You put yeast to make your bread swell up, right?
Yes.
For fermentation.
What is yeast?
Come on, guys, come on.
Yes.
Yeast is a fermentation.
Why is it on the vaginal?
Hold a minute, you go back. Go back there. What is yeast? Look at the definition.
Yeast infection.
Just yeast. It's a what?
Yeast are eukaryotic single-celled microorganisms classified as members of the fungus kingdom.
Full stop. That's all I want to get. Fungus. So when you have a yeast infection, it's a fungal infection. All right? It's a growth. You guys with me? That's why they say you find it on the skin also. And we can find it at least foot. It's a yeast or fungal infection. Right? Women who use a lot of antibiotics and change the pH in the vagina, they end up with it, right? Yeast infection. And you have yeast infection, and then somebody go and kiss down there. Do you think they're going to kiss somebody now in the mouth? What do you think could happen?
They'll have it in their mouth. They'll have it in their mouth, all over their lips.
Stop your noise, but all over the lips. Guys, in the mouth. All right.
What's inside?
And so when you, let's move on. You might have heard that you can use something called mycostatin or statins, and they will tell you to use it swish and swallow, or swish and spit out. It depends upon the doctor what he wants you to do. So when you get this candidiasis, you get nystatin or mycostatin, and they will tell you, you put it into your mouth, you swish it around, okay? Not gargle. People mix up gargle with swish. Gargle is when you put it in the back of your throat, you go, gum, gum, gum. Yes. Swish is when you, with your tongue,
you shake it from side to side.
Right, so you swish, and then you may say, spit it out. Or you may say, swish and swallow.
Nystatin.
Okay? So that's the medication that you use for that specific problem. Not like the oxycontin antibiotics, right? And whilst we're on this, the pharmacological part, for the other conditions, we talk about dental caries, extractions. Prior to extractions, you do something called prophylactic. Prophylactic is to prevent infections, right? And one of the drugs that they really like to use is a drug known as PenVK.
PenVK.
We use a lot of different things about the body, but the dentists love to use PenVK.
How you spell that?
Exactly what I just said. PenVK.
PenVK. Look up PenVK. Also known as penicillin V.
That's why it's abbreviated to pen.
It's an antibiotic used to treatment of numbers of bacterial infections, specifically used for the treatment of strep throats, otitis media, and cellulitis. Prevent rheumatic fever and to prevent infections following the removal of spleen.
All right. So
a lot of usage.
they use this a lot for prophylactic. But now they're kind of like being very careful with the use of antibiotics, because remember I give you guys the antibiotic stewardship. I give you guys that. And you guys are supposed to know that by heart. Because you're not going to go through this again.
Antibiotic stewardship
is to prevent the
Here's
misuse
some
of
information.
antibiotics. And these antibiotics misuse that cause patients to develop MDROs, which is your multi-drug resistant
antibiotic stewardship
organisms. So now the antibiotics don't work in them. Okay? And I give you guys that. I give you something called McGear's criteria. That the doctors have to follow McGear's criteria before they order antibiotics. The bacteria from your throat can go into your heart, and there's a lot of kids that have rheumatic fever. They get mitral valve damage. A lot of stuff are interrelated, guys. I need you guys to don't just read things and put it aside. I like to keep telling you every week. I'm going to let two of you come in front of the class and give us jokes for the rest of the night. Because two of you laughing all the time. I don't know why I got to separate you guys. So I will separate you. Trust me. I know 2 ways about it. So I will separate you. So don't do it anymore, please. All right. So, in the mouth, we can start with the candidiasis and what have you. You can have another situation occurring. And this situation is called a stomatitis.
Stomatitis. STOMI.
What is stomatitis?
How you spell that? Stomatitis is an inflammation of the mouth and lips It refers to any inflammatory process affecting the mucous membrane of the mouth and lips, with or without oral ulceration.
Look at images of stomatitis, please.
Got swollen cheeks. I see a baby. I see a baby with swollen cheek, and the lips is like that. You see it?
Now you see the
See it?
stomatitis?
Not there. I got a better. Not there. I have a better picture. Okay.
Right. Now what you're going to do
See that?
is list cause of stomatitis. Why the lips and the mouth get all inflamed and swollen.
Interesting. Causes stomatitis can be caused by a variety of different factors,
So let's hear the factors. What are the factors that cause stomatitis?
which may overlap with each other at the same time. Often it will be due to injury, infection, allergy, or skin disease. The most common causes are trauma from ill-fitting dentures or braces, biting the inside of the cheek, tongue, or lips, and surgery. Chemotherapy, another one is chemotherapy treatment for cancer. Another one is viral infections such as herpes. Another one is yeast infections such as thrush. Another is any condition associated with xerostomia. Can somebody look up xerostomia, please? Xerostomia or dry mouths. And finally, smoking, like she mentioned, or chewing tobacco.
All right, guys.
What's xerostomia?
What you heard just now is that some of the things we spoke about before cause stomatitis. Okay? So you see there's definitely a connection.
Yep.
We talk about the syphilis, which is Treponema pallidum. We talk about thrush, which is a candidiasis, or fungal infection, right? Talk about gout. Biting your nose every time you eat it, you bite your you never bite your inside your mouth when you're eating?
Yes.
And it pains like a bitch?
Never.
Really pains. Right? Yeah, when you bite your lips or your inside your
Bite
mouth.
your tongue. I never bite my lip. I bite my tongue before.
The list of the causes that I have, it has chemotherapy.
Absolutely. Chemotherapy make you lose your hair too.
But it comes back.
Make you drop your immune system. Put you at risk for infections. And then when you get to oncology, we're going to talk more about that. That's why you all try to remember things and go by, because these all have to be connected. Okay? And we haven't even left the mouth yet. Still got conditions yet to be in the mouth.
GI system.
And this is only the mouth. So what else can happen in the mouth? What else can happen in the mouth? You can get oral cancer, absolutely. Oral cancer. When you do oncology, you're going to be doing that. What else can happen? You can get an oral abscess, absolutely. An abscess in the mouth. And we know abscess is a pus-filled cavity. And what is a pus?
It's dead white blood cells.
And it's purulent. What else can happen in the mouth?
Cold sores.
You got herpes simplex type. Herpes simplex type. Don't say I don't know. Don't become like that girl. She's rubbing off on you.
I'm looking at
Herpes simplex type what?
1 or 2.
I'm listening. I'm waiting. Find out. Herpes simplex type. Which one causes cold sores?
Oh, sorry.
Go ahead. Let me hear.
Cold sores. Type 1 herpes simplex. Type 1 herpes virus infection.
Here, guys. It starts at the top, so make it easy. 1 is the top, 2 is the bottom. 1, 2. Okay? Herpes type 1,
So
herpes
top,
simplex type
2. Got it.
And you said shingles is no. Shingles is herpes zoster.
Mm-hmm.
Completely different. They're all viral.
Mm-hmm.
So when you get it, it's there for life.
Mm.
So all people who get cold sores in your lips, you have it for life.
But it goes away though, right?
Most people have it.
It goes away.
It goes away and come back.
Yeah. Sometimes
It comes back when your immune system is down.
sometimes don't come back for
And many
years.
times you see people with this little thing here,
Mm-hmm.
and they call it fever bumps or fever blister or whatever. They got herpes because they kissed the wrong person.
Oh Lord.
Person kissed them, give it to them. That's why you don't have people go around kissing your babies. Like some people like to kiss babies in the mouth, like mwah.
Wow.
Yeah.
Don't be kissing nobody's baby like that.
Don't put your lips in the child's lips.
No way.
Yeah. Even you are the father because you might kiss other places and
Even the mother too.
That's
the
true.
father most likely
They say that it
doing it.
doesn't go by the
After the
suction bell.
guys, you
No,
say the father's too.
even if you're the mother too, because you can
I just I
you cannot get it from the maid.
Here's the guys. I always like to share things that we tell for people's mind and how people think, and things that we think is really abnormal. We heard about our former governor, Mr. Coleman. He was charged with what?
Sexual abuse.
Allegedly.
Right? So allegedly, he lost
Allegedly.
his job because of sexual harassment. His brother lost his job at CNN also for sexual
Misconduct.
harassment, right? So we have two brothers who had this problem, or so they're saying, right?
Allegedly. Mm-hmm.
Right? That they had it. Then, listening to the news 2 days ago, Chris Cuomo had a very personal friend or confidant who have sex with children.
Oh Lord.
Now let me finish. He having sex with children is a problem, the pedophile. But what was most disturbing was that he will contact the parents of these 9 and 10-year-olds. And the parent will bring him 7 plane tickets, and that parent will bring the child so he can have sex with the child.
Oh God.
Now, this is here in America. So what I'm trying to say now is that this thing can happen anywhere. It happens all the time in Thailand. Americans leave America to go to Thailand to have sex with 9, 8, 10-year-old little, and they're sold by their parents.
Yes.
Their parents have given it. It is now happening in the United States. This guy was selling plane tickets and the parents jumping in the plane with the little girls and bringing them, and then having a mother and daughter having sex. Why does he look on? So, you don't know what people is going on in people's mind. That's what I'm trying to get across to you. Right now, we may be shocked, we may say whatever, but people have a lot of different screw things going on in their head, and you don't know, because some of these persons are up there, big ones in our society. But then they're doing some nasty, weird shit behind closed doors. That's why they say what happens in Vegas.
Stay in
stays
Vegas.
A lot of things is happening behind people's door. Some of you might be doing oral intercourse every night, but it stays behind the door, right? I know you do that. All right, just kidding around, guys.
There's nothing wrong with that.
Guys, please. One of the things you have to remember
That's not a big
is
problem.
that a lot of these, whatever is happening in the society, right? You want to pay attention to, because a lot of times In fact, all the time,
Oh.
the people who prepare these NCLEX exams are nurses. They look at situations that's happening and they prepare exams. Okay? I know that I don't want to follow up what's in the news because it's too much. Look at what's going on. Right? It's going to make you be